News Update Coronavirus March 31. Note, this is a collaborative video made between Travel for All Fanpage and Knowledge of Coronavirus channel. Please respectfully welcome everyone. The following is the remarkable news most on March 31, 2020 as follows. 1. Recall basic knowledge about coronavirus so everyone can raise awareness about this dangerous virus. Novel coronavirus is the proper term for this brand new virus wreaking havoc on our unprepared world. But you can also call this nasty villain by its scientific name, severe acute respiratory syndrome coronavirus 2, or SARS-CoV-2 for short. Becoming infected with SARS-CoV-2 can trigger a potentially deadly respiratory disease called COVID-19, an illness which presents with three main acute symptoms: fever, a deep, dry cough and a shortness of breath, which can become quickly life-threatening. Other symptoms can mimic a cold or the flu. 2. Illinois governor says Fed sent wrong type of protective medical masks. In fact, Illinois Governor J.B. Pritzker said Monday that the federal government sent the wrong type of medical masks in a shipment that his state recently received. Illinois received were surgical masks, which are not considered respiratory protection by the Centers for Disease Control and Prevention and are not totally effective in preventing coronavirus transmission. 3. Nearly 3,000 people die from cough in Iran. Iran recorded 141 more deaths from cough in the past 24 hours, bringing the number of deaths to 2,898 out of a total of 44,606 patients. Iranian Ministry of Health spokesman Kayanash Jahanpur said there were 3,111 new cases of cough have been reported. 3,703 people are in critical hospitalization and 14,656 patients have recovered. The Iranian government on March 25 decided to ban movement between localities at least until April 8. Officials also repeatedly called on people to stay home to prevent the cough from spreading, but did not issue blockade orders in cities. 4. The saying touched the hearts of people in France: wipe away tears for yourself and wipe patients' tears. French nurses and doctors have struggled with a coronavirus pandemic in a shortage of protective gear and worried that they would infect their families. Nurse Elise Cordier confided on my personal Facebook page that I woke up this morning, I cried. I cry at breakfast, even when I'm getting ready. But she got rid of all her fear. She still had to continue doing her job. She confided to continue. I wipe off the tears in the dressing room. Inhale and exhale. Those who were still in the sick bed were probably crying. And I need to be the one to wipe their tears. Wishing them, as well as nurses and doctors around the world, for peace forever. They are the real heroes who are fighting hard with the coronavirus. 5. One concern is that some experts say they have not ruled out the possibility that cough will directly affect the patient's heart. A COVID-19 patient in Seattle, USA recently died after a heart block. The study, led by Dr. Zhiving Liu of Zhongnan Hospital, Wuhan University, found that 20% of patients hospitalized for COVID-19 in Wuhan showed signs of heart damage. A 64-year-old patient in Brooklyn with no history of cardiovascular disease was diagnosed with severe heart attack symptoms and was diagnosed with COVID-19. 6. Vietnam supports Germany with 6,000 sample tubes. Vietnam-Germany Medical Research Center (VG Care) in Hanoi on March 30 sent 6,000 tubes to collect samples to Germany. A statement from the German embassy in Vietnam on March 31 said, "These devices will be used in the clinical trial of cough-treated drugs initiated by the University of Tübingen, the University of Hamburg and the University of Stuttgart, starting April 1. The mutual support between countries during the coronavirus season is always worthy of respect." 7. Look on the worldwide COVID-19 map. Tuesday, March 31, 2020, 06:35, GMT +7. COVID-19 has appeared in 200 countries and territories, making nearly 800,000 people infected. Nearly 38,000 died, of which Americans infected with 164,790 people died. 3,178 people. Italia people infected is 101,739, died 11,591 people. Spain infected people are 94,417, died 8189 people. China infected person is 81,518, died 3305 people. Germany has 67,051 infected, died 682 people. Iran has 44,605 infected, died 2898 people. France has 44,550 people infected and died 3024 people. In England, 22,141 people were infected and 1408 died. Vietnam has 207 people infected and has died 8. Difference between anti-coronavirus epidemic between Korea and Japan. South Korea has received global acclaim for its rapid capacity building in a short time and has so far tested more than 394,000 people, detecting nearly 9,600 cases. While Japan, for weeks, became the focus of a debate. A series of questions have been asked, such as, does the country register lower numbers of infections than South Korea simply because they have fewer tests? Is the Japanese government allocating resources wisely, or is it wrong in its anti-epidemic strategy? People should not go to health facilities if they are not too ill, said Hitoshi Ashitani, a professor of virology at Tokyo University, a member of the Japanese Government Advisory Council. Supporters of this argument argue that it allows the Japanese health system to focus limited resources on people who are seriously ill and keep the number of deaths relatively low. To date, Japan recorded 56 deaths from cough. 9. The number of cough infections in Russia exceeds 2,000. Russia recorded 2,337 people infected with cough, an increase of 500 in the last 24 hours, of which 17 died. Moscow confirmed 1,614 cough infections, up 387 from the previous day and the highest number of cases in the country. City health officials say more than a third of cases between the ages of 18 and 45% are children. 10. Strategy to help Singapore protect health workers. Singapore doctors and nurses are divided into separate groups working on a fixed shift without contact with other groups to avoid transmission of cough. Lack of cooperation, overwork and lack of supplies are factors that make it difficult for health workers around the world to fight COVID-19, leaving many infected. This is a collaborative video made between Travel for All fanpage and Knowledge of Coronavirus channel. Thank you for always watching and supporting our videos. Knowledge of Coronavirus channel and Travel for All fanpage respectfully, and see you in the next video.